Hey everyone, welcome. I am absolutely thrilled to be here with you today. As a visiting clinical specialist, I get the incredible privilege of stepping into facilities just like yours to help teams streamline the amazing work you already do. So today, we're diving into this explainer we call the craft of care. We're going to look really closely at our core facility procedures, specifically how these everyday common sense operational steps completely center around resident dignity. Look, my goal today, it's not to just talk at you. I'm here to support you as professionals, break down some of these high-stakes procedures, and honestly, show you how getting these daily baselines right is exactly what empowers your team and protects the people you care for.
All right, so here's our roadmap for this session. First up, the core of our care. Then we'll move right into conducting proper face checks, tackle high-risk and crisis steps, go over law enforcement and reporting, and finally wrap things up with shift handoffs and documentation.
So, let's jump right into Section 1, the core of our care, and what it really means to center resident dignity.
Now, the absolutely crucial point to remember here is that resident dignity and facility safety, they aren't two separate things. They're literally one and the same. Our guiding philosophy is simple. Residents are people and community members first. When we're navigating challenging behaviors, especially, when substance use is involved, we have to remember that our residents are often the targets. They're targeted by predatory dealers and bad actors from the outside. They are not the problem themselves. They are patients first. Approaching our daily work with this exact mindset isn't just some nice feel-good idea. It actively, physically protects vulnerable people. And when we do this work well, it's a total win-win-win. It's great for the residents, it's great for you as the staff, and it strengthens the whole surrounding community.
Okay, moving right along to Section 2, conducting proper face checks. This is really the baseline of our safety and awareness.
I want us to kind of reframe how we think about rounds for a second. These are not just annoying administrative chores you tick off a clipboard. No way. They are critical, compassionate, and potentially life-saving visual confirmations of a resident's well-being. Because face checks must be individualized to actually be dignified and effective, we basically use two main tiers. First, there's the general population tier, where consumers are monitored on a standard routine interval. But then we have the elevated tier. For these consumers, checks absolutely must happen on the facility's shortest interval. And here's the regulatory anchor you need to remember. That exact shortest interval must be uniquely specified right there in the resident's individualized treatment plan, or ITP. That way, the paperwork perfectly matches the actual care they're getting on the floor.
So you might be wondering what exactly moves a resident out of general population and bumps them up into that elevated tier. Well, there are several specific triggers. We're looking at recent substance use, a history of elopement, having an identified offender status, any recent suicidality, or if they are post-restraint. If literally any of these factors are present, the consumer legally moves to that shortened, customized interval to make sure they stay safe.
Let's look at how these intervals actually play out in specific scenarios, giving you a really common-sense baseline for the floor. For a new admits first week, checks are hourly. If you've only got one staff member on duty, it's every 2 hours. In therapeutic separation, a clinician needs to lay eyes on them every 15 minutes, and for a post-restraint medical check, that has to happen within 10 minutes. Pin these clocks in your mind, guys. They are your ultimate guardrails.
Now, actually doing the check is only half the job, right? Documenting it correctly is the whole other half. Here are the 4 completely non-negotiable items required on that per-shift rounds log. Step 1, your staff initials. Step 2, the exact time. Step 3, the location. And Step 4, the resident status. It's just a quick, straightforward, step-by-step process that guarantees total compliance.
Listen, I really cannot overstate the importance of this phrase. Undocumented rounds are rounds that didn't happen. That is the ultimate regulatory mantra. Honestly, real-time, accurate documentation is the absolute strongest protection you have for your own professional license and, of course, for the resident's safety. If it's not written down on that log, well, from an outside surveyor's perspective, it just simply didn't happen. Keep that log accurate, and you keep everybody safe.
All right, that brings us to Section 3, high risk and crisis steps, and how we navigate intense moments with precision.
Navigating these intense, high-stress moments requires real precision. When emotions run high on the floor, our procedures just need to be rock solid. Our primary goal is always de-escalation, reading those early warning signs and using calm, supportive responses way before a situation peaks. But look, emergencies do happen, and when they do, we follow structured guardrails. Restraint is strictly a last resort. It's used only in severe behavioral emergencies. It is never, ever for convenience. If a restraint is required, it absolutely must be the least restrictive method for the briefest possible duration done safely and heavily, heavily monitored.
And if a restraint does actually occur, an exact sequence of actions has to kick in immediately. Step 1, a nurse must examine the resident within 10 minutes. Step 2, immediate notification of the psychiatrist. Step 3, a qualified mental health professional needs to debrief the staff right afterward. And Step 4, full comprehensive documentation in the record. These exact steps are what ensure clinical compliance and, most importantly, the resident's safety.
Another critical crisis scenario we face is substance use and overdose. The common sense procedures here are literally life and death. You got to know how to spot the early signs of an overdose and know exactly how to access the facility-wide naloxone rapidly. And remember our core philosophy. We handle these moments entirely without judgment. We treat the patient. Finally, tracking these events as safety metrics is what allows us to systematically improve our care over time.
Let's move right along to Section 4, Law Enforcement and Reporting, and Building a Lawful Cooperative Partnership.
When it comes to law enforcement, we're not just winging it or informally freelancing our community relations. We are actively building a structured bridge that protects our facility and our residents. For our law enforcement liaison duties, transparent, lawful cooperation is exactly how we position the facility as a strong partner in protecting our vulnerable residents from external, predatory trafficking. When we coordinate directly with police, especially regarding identified offenders, we are executing state code and taking firm control of our residents' security.
To do this the right way, we have to absolutely lock down our critical notification clocks. For identified offenders, the Department of State Police must be notified immediately, no waiting around. Any criminal code incidents? Those must be reported to local law enforcement within 24 hours. And within 72 hours of an identified offender's admission, a fingerprint-based inquiry must be arranged. Zero delays in reporting literally means zero gaps in safety.
And hey, just like our face checks, every single contact with police requires strict, clear documentation. The dedicated law enforcement contact log has to include these 5 specific things: the date and time, the specific incident, the exact officer's name and badge number, what was reported, and any follow-up required. This single log is hands down your absolute best evidence of transparent, lawful cooperation.
Finally, let's look at Section 5, Shift Handoffs and Documentation. This is all about safely passing the baton.
You know, at the end of a really long shift, all of these procedures, the face checks, the crisis interventions, the reports, they all bundle together. Now it's time to safely pass the baton to the incoming team. A common-sense procedural step that can literally make or break a facility is instituting a highly structured written and verbal shift handoff. We use the SBAR format: situation, background, assessment, and recommendation, alongside a daily clinical operations huddle. This is that vital convergence point where nursing, mental health pros, and leadership get totally in sync.
So what actually goes into that structured handoff? Well, the signed SBAR log must include a very specific checklist. You've got to cover your high-risk consumers and their specific face check tiers, note any restraint or separation events from your shift, highlight new admits, medication concerns, elopement watches, any pending regulatory or police reports, and, yeah, even the environmental status of the unit. Getting this exact checklist signed off ensures absolutely nothing falls through the cracks between shifts.
Before we wrap up today, I really want to leave you with this core cultural message. When you are unsure, it is always right to ask, check, or escalate. I mean it. In a healthy clinical environment, speaking up is heavily valued. It is never, ever punished. Raising your hand when you need some support or escalating a concern quickly, that isn't a sign of weakness. It's the mark of a true, dedicated professional.
Which leaves us with this final question to think about. How will your diligence in these exact steps today protect the residents, support your team, and strengthen the community tomorrow? Getting these few common-sense procedures right, doing the face checks, documenting honestly, responding without judgment, and passing the baton safely, that is entirely within your power. It makes a massive, real-world difference in the lives of the people who call this facility home. Thank you so much for your time, your focus, and for the incredibly important work you do every single day.